So, hi everybody, we are here again in psychological journeys, and today we are going to speak about CBT, cognitive behavioral therapy, in hospitals and in university. And so I'm here with two guests, Dr. Ahmed. Okay, please introduce yourself.
Hello, my name is Ahmed ElBarawi and I am an orthopedic surgeon in profession. Right now I'm working as a full-timer lecturer at BSBI, living my time with the students of our lovely BSBI.
Fantastic. And we have our lovely counselor, Sangeetha. Okay, so please introduce yourself.
Sure. Thanks so much, Dr. Barbara. Hi, everyone. I'm Sangeetha George. I am the Student Engagement Manager here at BSBI, and I also look after the student welfare along with my colleague Francisca. I come from a counseling background. My master's is in counseling, and I've been doing it for over 20 years, both individual counseling and career counseling. And yeah, that's me.
That's fantastic. That's fantastic. So I am Barbara Gabriella Renzi, Dr. Barbara Gabriella Renzi, and we are going to speak about cognitive behavioral therapy. Before giving the words to our guest, I'm going to introduce very briefly cognitive behavioral therapy. I know that my students here already know some the major things, major issues, everything, but I'm going to introduce it anyway. So I would like to speak about the metaphors, because sometimes it's better to, to speak lightly about important things. And so I'm using the metaphor of the garden. So our mind is a garden, and there are really lovely seeds like roses and violets, lots of flowers, and maybe lots of rice food for our mind, but there are also weeds. And cognitive behavioral therapy, imagine it's a gardener who comes there and helps you to divide, okay, this is a rose, it's very much good, but this is a really bad weed for me, I don't want that. And yeah, and that's it. So that's why it's so important. They start treating just depression, thanks to Dr. Beck, and then became something that was more and more, okay, so was used for different things. The very important things about CBT is that it's been tested. So it's been tested, we know that it works, so it's scientific, so that's why. And it's very brief, between 12 and 20 weeks, so so it really works. It's like a toolbox for yourself, While you do CBT, you learn also how to think differently, how to see the world differently, but you don't need always a therapist there that is helping you, right? So with CBT, it's not like that. You don't need always somebody, because you learn what is best for you. You learn to see the world as it is. The world is not perfect, we know that, but we shouldn't be so positive, we shouldn't be so down. So we shouldn't have really rosa glasses or, very blue, dark glasses to see the world. We should be in the middle. CBT helps us. So I'm going to speak with Dr. Ahmed, who is going to tell us something very important about symptoms, no?
About symptoms and manifestations for those who are in need for the CBT. First of all, I would like to mention here the definition of health from World Health Organization that was including the mental, social, and emotional well-being of a person, not merely the absence of a disease, a physical disease. So when we talk about CBT, we have to think about that triangle consists of the emotions, the behaviors, and the thoughts, which is the cognitive part of the CBT. So for medical perspective, if we talk about in hospital settings and clinical settings, we have to understand from the people's point of view, how well am I, my well-being, is it affecting my physical well-being,
Yes.
or affecting my mental well-being, or my emotions are being affected. And understanding that they are interrelated to each other, that would really help understanding more about ourselves and how am I reacting and responding to my surroundings, including even physical harm if I am in danger maybe. So it's really important to understand those three parts,
That's true.
which is going to be helping us understanding what is next. I could give an example maybe, including someone is in pain maybe. But an experiment had been done for understanding how painful is a stimulant could be. That I could press maybe on my thumb as powerful as I could, and if I ask you 0 to 10 scale, how painful is it? It cannot be 10. Yeah? So, but what if I ask you to press my thumb, and I press her thumb, and everyone is doing the same? It will end up with everyone is complaining of each other. That was too painful for me. It was, although we might be applying the same pressure. What happened here? That my perspective, how I saw it, do I feel in danger? And this is how our body is reacting to pain or dangers around us. Whether being physical pain, emotional, or mental, that I face a situation or so. And here the CBT role is coming, that I need to understand each component of them and its relation to the other one. So your question was about the manifestations for CBT need. In general, they are again being classified into emotional, that I have sadness maybe, I feel that I have mood swings maybe, and so on. Or I have a physical one. I feel restless, I cannot sleep well, I cannot follow my sleeping rhythm. That could be a sign for. Or could be social, like in your behavior, could be including that I am desocializing myself. Maybe I'm not feeling like being present with my friends maybe or family. That is affecting the situation again. And it is a sign for us and a symptom for people to say, there is something I need help with.
Yes, it's true, because as he was saying, CBT is used, started using back for depression, and that was really a breakthrough, and it was in the 70s. And then, you know, building up, it worked with different, you know, anxiety, and then, you know, also suicidality, you know, OCD, and when you are addiction. So it's being used in different, for different issues that we might face. And what he was saying was really true, that, you know, we have the thoughts that affect the emotions, that affect the behavior, but it's really difficult to change the emotions, right? How do you change the emotion? Okay, stop being sad. Yeah, I mean, it doesn't work. No, it doesn't work. So either you work with the thoughts, you know, or you work with the emotions, and then this is the thing. And I want to say that just to make, you know, we know that there is behaviorism for the behavior. You know, who studies psychologists probably have heard of it. Watson, Pavlov, you know, Skinner, and everything else. We have the behavior. We have the cognitive part, that is, you know, about cognitive psychology. But the change of the thoughts come also from philosophy, because psychology and philosophy, they were sisters. I mean, actually, no. Philosophy is the mother, psychology is the daughter. I mean, I think they are female for me, okay? Just open.
I agree.
Open up. You agree, right? And, you know, and from ancient philosophy, I'm not going to be there, but look at your thought in a logic manner. This has come from ancient philosophy, the Stoicism. So, and what he says is very different, very good. It's a circle, and also when you're really in painful situation, a really bad situation for yourself, you have to start working on either your behavior or your thoughts. Okay, but Sangeetha, I think she's going to tell us the world, no, about this, you know, her experience, everything.
So just a little background, I think CBT has been my hot favorite right from when I did my bachelor's in psychology itself, and just understanding the different techniques that we could use in psychotherapy, whether it was ABA or behavioral or regressive therapy. CBT always stood out because, first of all, like you mentioned, it's short term, right? Yes, you have to go a little bit back in your life to kind of figure out what triggers are, but the healing is quicker. We don't have to go, I don't have a problem with going to when we were children or whatever, but when we, especially in a university setting like BSBI or working in a business school here, we have 5,000 students we're working with, and sometimes we have 3, 4, 5 students a day who want to come and see us, and also in repeat, right? They come almost every week, maybe they want to see us. And so we're looking at techniques that can, not that it's quick, but we want it to be effective. And it's been scientifically proven that CBT produces change, and you said it yourself. And I remember, I was shocked when I was preparing for this. I remember one of my professors putting it into our heads, A plus B equals C. And that's what I've, you know, practiced in my life. That's what I think I've also tried to train our students. A stands for antecedent, which is your trigger. What is your trigger? Plus B stands for behavior, which is when you have a trigger or a thought, how do you behave? Equals C, which is the consequence, which is the feeling, right? So we try and go to the trigger, which is the A, because if you change that, then your B is different and your C is different. And so when we often work with students that mainly deal with anxiety, we see a lot of them here, including ourselves. We're all international. Moving to a new country can be so overwhelming.
That's true.
And so it's just too much of everything, and there could be just one trigger of someone looking at you badly on the U-Bahn is enough for you to, you know, think badly, behave badly, and therefore lead to a consequence. So kind of anxiety is one thing, goal setting is another one that we help students with. We often hear students say, but ma'am, I'm so depressed, which sometimes is very loosely
but doesn't mean depressed,
used. Yeah, just because the sun is not shining and you're lying in bed for 2 months does not necessarily mean you're depressed. You just don't have the energy to get up and come to class. And also finding purpose. We find a lot of them come so determined to Germany, to Berlin, to BSBI, and then after 6, 8, 10 months, like, I have zero purpose. I don't know what I want to do with my life. And so reframing all of those things, I think, is mainly what we are working towards.
That's fantastic. Have you ever had the students that fail something and start saying, oh, I'm a failure. I'm a failure. But what do you say? You just failed one thing, you know?
All
what do
the
you
time.
say?
I'm like, yes, you are a failure. No, I don't say that. Not at all. I'm like, join the club. No, I don't say that. Of course not, because then it's about helping them think about what's going right in your life. Yes, you failed this assignment or you failed this exam, but there's so many other things that are working out beautifully, you know?
That's true.
So just helping them refocus. It's easier said than done, Barbara.
I know.
It's very tough sometimes to help students because they'll be so positive and they'll be like, yes, I will journal and I will write all these positive things, and you meet them the next week and then they're sitting for 1 hour crying with you, and it's like, dude, I just helped you last week. But then, you know, I mean, I get where they're coming from. I know how difficult it can be. I think we've all studied outside of our countries. We know what that's like living outside. So yeah, it's very important to continue to be empathetic and help them through that journey.
Yes, we catastrophize. I mean, it's normal, but CBT, as she beautifully put it, says, okay, you failed one exam, it's not the end of the world. No, it's not the end. You can do lots of different things. Can you bake, for example? I cannot bake. So everybody who can bake is, you know, a genius. Can you bake? Can you do that? So you're not a failure. And, you know, this catastrophizing maybe happens also in the medical, you know, for you, you met people who were really sad and everything else. Yes. Do you want to add something, or what do you think? It's very important.
I would say that communication is most important here, and from patient's perspective, maybe that being aware that I might be in a need for help,
Yes.
To speak it out, and to who? Who could listen to me for what? Am I here in the hospital only for physical illness? And what about the psychological part of me? And there are many diseases are related to hospitality and hospitalization. Like people could get stress ulcer, for instance, chest diseases, only
stress
from the
that-
stress we receive
stress
in
is
that
huge, yeah.
clinical setup. So that needs to be communicated. The question here, is it supposed to be coming from the patient, or the initiation is coming from the health providers? I would say that within the healthcare systems, it is from the health providers, the healthcare managers, and the physicians themselves, together with the psychiatrists and the psychologists, and to be able to afford the chance for the patients to be listened to.
Yes,
It is time consuming and resources, of course,
I know.
but this is how it should be.
It should be. It should be like that, and it should be also part of the society, not to be scared of being scared. You know, you know, because everybody has anxiety, everybody has fears. You know, we just don't say them aloud because we want to appear tough. But the person is tough. What does it mean being tough? That's the question. Being tough maybe is being who we are. You know, we are all fierce, we are all human beings, and nobody is different. Yeah, and I remember, you know, once my, you know, was Anne Murphy, my CBT teachers, she told me once, you know, everybody has depression. It's like, you know, everybody get a cold, catch a cold. So, I mean, it's not true that everybody has depression, but it's very common. So just demystify this problem of depression. It's something that is common. One in third people can have it. You know, it's women sometimes are more prone to. You know, it's very common. So we shouldn't be afraid of talking. And actually, here we have, you know, you have the chance, students, to go to a counselor. You know. We live in Berlin, you know how it's difficult to book any kind of appointment, psychological appointment. So, Sangeetha, for you, but I'm telling you, all go to her, you know, and Francisca is there, yes.
I meant to bring our poster so that if students see it on campus, and if anyone's watching or students who are here, when they see the poster, they're like, ah, that's where we could get help. Because like you said, we really do want to normalize on campus that it's okay not to be okay, right? We don't always have to have a smile on our faces and walk around. It's okay, and this goes for the staff too, right? I mean, it's okay to have a down day, and that's why we try and promote workshops during Mental Health Awareness Week. We're trying to have support groups on campus. But the challenge here is that we come from cultures maybe that it's not okay to talk about these things, but what we're trying, and I think all of us together as a community, we can build it to be a safe space for people to be able to talk and get help.
Yes, yes. I have a question for you. Maybe also students with low self-esteem.
Yeah, huge. Yeah.
Huge. You know, what you do, dialogues. You just to try to.
So, like I said, and that's a great example to actually, you know, just talk about. I do have a student that I'm working with regards to self-esteem, and I think a lot of it comes from self-thought, right? What are you telling yourself on the daily basis about this? I'm a failure, I didn't do well, why don't people like me in my classroom, why haven't I got a job, I'm useless, my parents don't like me that much, they're not proud of me. So when that's constant, you start to accept who you are. So what I did with him, the first time when I talked to him, there was a lot of tears. The second time, I asked him to start to write things that he's saying to himself, so that we can then reframe. All it sometimes takes is to change one word in a sentence,
Yes,
you
true.
know, and so to then rewire his brain to start saying different things to himself, because he's a wonderful, wonderful boy,
Yeah.
but just super lonely and really lost at this point.
I mean, we are in a pandemic of loneliness. That's why everybody is going to use chat box, artificial intelligence. But what makes the difference is the alliance. So it's the alliance between me and the person who's listening to me.
Yeah.
And that's make you, yeah, there are the techniques, but if you have in front of you somebody with no empathy, with nothing, you know, which is repeating like a parrot, how can you grow? You know, you can learn some things, you know, if better than nothing, but you cannot really grow. And I think Sangeetha is perfect here, because what we need is trust, no? And
Yeah.
she gives us trust. Can you trust a chat box? I mean, how can the word trust is going to have a different meaning here? What does it mean, trust? You trust that it's going to answer, yeah? Logically, it's a chat box. If internet is working, there is enough energy, it's going to answer. But is really trust? When we have, you know, a relationship, the trust is something different, you know, it's something more deeper, it's something that tells you, you know, when you have a relationship with a friend, what is trust there? Is, you know, you trust that maybe is there to support you, but you trust that it's going to tell you off when you do something wrong. Oh, what are you doing? What you're very on? No, this is, no. And maybe you know that the relationships are difficult, no? There's something difficult there. Sometimes, you know, they make you suffer, but this is part of life. And can you trust a chat box? What do you think?
No, absolutely not.
I
I was
agree.
actually having this conversation today with Fran about how dependent can you be on ChatGPT, but that's a whole different
Yeah.
webinar that we can do. But just on the basis of what you were saying, the flip side of trust is that students sometimes get so dependent on us.
Yes.
So then there's a need to speak to us every alternate day or every week, because
Much.
they know no other. So when we are practicing something like CBT, it's mindful to kind of make a student strong to be able to stand on their own two feet, to be able to think for themselves, to be able to, you know, kind of take life decisions on their own, that they don't have to come to us. So we often have students who will keep coming back to us because they know no other. And it's just, how do you say, I'm done with you, bye-bye. I'll see you now, never.
It's
you know,
a-
you can't do that. So it's very important to kind of lift them up, empower them, and then let them out again. And know that we're always here. Don't worry, come to us whenever you want. So for those who are listening, if you want to come to us, we're in the new, I'm not doing a marketing stint here, but if you genuinely need some help, please don't hesitate to come to us or write to us. We're in the new building. Come see us and we'll be happy to support you.
Yes, so she was speaking about psychoeducation, and what is just linking what he was saying, because he said, you know, psychoeducation should be part also the medical. You are psychoeducating the students, and he says psychoeducation should be part also of the medical entourage, or the, you know, or the professionals there, because, you know, when they know how it works, they can help the client a bit as well, and they can tell the patient in this case, and they can tell the patient, maybe you need to speak with somebody which is part of your, you know, of the profession, of the helping profession. Yes, I think CBT is very interesting. You know, I remember we did an experiment when I was doing my CBT, you know, training, and so yes, we were in this school in Belfast. I did the training there, and some people have social anxiety. You know, they say, you know, I go in a place, everybody's looking at me, but in reality, nobody cares because we are all busy.
Yeah.
So, and there was the head of the school, Anna Murphy. She told us, okay, you have to put yourself so much makeup that is unbelievable, you know, green, you know, everything. And we went to a coffee shop there with all this makeup. And we sat there and nobody cared. And it was really, you know, CBT is fun as well, you know, because, you know, we have pink hair and, you know, I never put makeup. For me, it's something that I'm not used to and, you know, all this makeup going on with these green lips, somebody came and everything else. We sat in a coffee shop at the center and we sat there and nobody looked at us. And you have to imagine that Belfast is a very small city, you know, it's not Berlin. In Berlin is more. And do students come with these problems that they have social anxiety, maybe?
A lot of them, I think, come hoping that they find friends or support system from their same community. This morning I had a student sit in my class. He joined last year, October 2024, and he said, I don't have one friend in my class. So can you imagine, one whole year he's been attending classes, or barely, and not one friend.
It's difficult, it's Berlin.
Which is, and I'm not sure if that's because he's not comfortable with the English language and not wanting to speak, or just not interested to, or have the aptitude to make friends in the classroom. And that's what some of the challenges I wrote out with regards to even helping students using the CBT technique. First of all, I think, I'm sure you'll agree with me, Ahmed, we know that our students have too many stress factors. We see that, right? They're trying to balance their finances, their assignments, trying to find a job, accommodation, trying to find food, like fending for themselves. So I think there's a lot. So when there's too many things that's bogging their mind down, it's very tough for them to have clarity of thought, you know. So I could sit there and say, yes, change your self-talk and change how you're talking about yourself and be more positive. And they're like, about what? I have nothing to be positive about, you know. So we really need to be mindful and meet students at their point of need, I think. Second is helping them find life balance. I think that's a challenge. Third is they find unhealthy coping mechanisms. Here in Berlin, when I moved here 2.5 years ago, my father at my age told me, remember Sangeetha, everything is permissible in Berlin. And it's so true. There's so many options. So if you don't choose the right way and the right coping mechanism, you could go down a very dark rabbit hole, I think. And the last is cultural backgrounds, that maybe we don't come from places where it's okay to talk about our problems and bring about change. So those are some challenges that we face working with students, and so sometimes there's roadblocks, but we believe in change.
Yes, you're strong.
We believe in the betterment of our students. So yeah.
But what about stress? You said the stress makes us sick. Do you want to speak about it a bit?
Definitely, stress makes us sick. Could be even reaching the level of that person I met in my practice who came to the hospital with high fever, cannot walk because of imaginary thoughts about how many cells are dying while walking or flipping on the bed. So,
wow.
Yes, this is purely of psychological origin. The thoughts reflected on emotions, and then it had end up with a sick person. Yeah. So definitely yes, and what we are doing here in our explanation could be helping our audience maybe to find a way for disrupting one of those three components first, and then trying to change, which is going to be just to break that feedback mechanism we are having between among the emotional, the mental, and the behavioral ones.
Yeah.
So I don't think that we have enough space and time here for explaining more, but I think this example...
That's a very interesting example, because when we are stressed, you know, the heart, I think there are, you know, all the hormones going around, you know, they make us, you know, feel bad. We know that we can die from stress.
Intellectuality could be a solution here, that this person, if understood how many cells are passing away at the same time, how many are being regenerated.
A bit of biology.
Okay, I will not be very sad about those ones
passed away. 1 to 1, 1 to 0, 1,
Yeah,
yeah, I think, you know, stress makes us for sure sick, and all these automatic thoughts she was talking about, they're like clouds coming and going, so you have to grasp them and write them down as she's doing, and look at them if they are really real stuff, or they're an exaggeration, we are catastrophizing, or we think the world in black and white. Sometimes that's the reality. And also I think we are in an area which there is the morality of being positive. Everybody has to be 100 times positive, everything is positive. And CBT tell you, don't be positive.
It's okay.
Be down to earth. And you are not a genius, but you're not really the worst. You are a normal human being. You can do stuff. Maybe you're better in something. You have to study a bit more something else. Nobody is perfect. You have just to learn. And yes, and the thing of the core belief also is interesting. The different core beliefs about the self, the world, and the future.
We always tell students the fact that they've chosen or taken an appointment or walked to our door is the first step itself. That itself shows progress. They took that time to do it, not because they're desperate, but because they want some sort of change. And so we believe that they come there with a mind that's open to wanting change to make their quality of life better. So we always give them a pat on the back or give them a hug saying, well done that you're here right now. And then we're there to support you through the rest of the journey. So yeah,
that's true. That's true. Yeah. Because maybe the only person who cannot be helped is the person who doesn't want help.
Yeah.
Yeah. Because how can you? No. This is the question.
Yeah.
Okay. And maybe we can start with the different questions. Do we have questions? We've been talking a while. We've been talking about different things. Maybe we didn't talk about the core beliefs that we have about the future, the present, and the world, and that makes the automatic thoughts. And through the three-part models, we change the automatic thoughts, so we change the core beliefs, and But she was speaking about also psychoeducation, the importance of psychoeducation, so you become your therapist, no? She was saying you cannot always come here, not because I don't want you, but because I want to empower you.
Yeah.
I want to tell you how you can catch your thoughts, bring on your, on your piece of paper, look at them in a logical way and down to earth with your both feet on your planet Earth, to see if they are too much in one way, too much in the other. So you learn through psychoeducation to become who you can be. No?
A plus B equals C.
Now you will learn it. So we don't have any questions from you?
Amazing.
Don't be shy. Thank you so much.
Thank you. What's the significant barrier to implement CBT?
Okay, maybe this is a very practical question. What is the barrier of implementing CBT? What is the obstacles that
those were the challenges that I talked about. I mean, at least in BSBI.
Because sometimes in typical school setting, typical college setting, it would be really difficult to implement CBT. There would be certainly certain barriers. I would like to know at least one barrier connecting to CBT that would affect the student's life much.
Yeah. So CBT is something, it's a technique that we use on a one-to-one basis, not necessarily a group setting, because like I said, you need to meet the student at their point of need. You don't know what kind of thoughts they're having, and maybe too dark and too personal for them to have in a group setting. So like I said, for me, the biggest challenge would have been, or the inhibition of practicing CBT are the stress factors that a student already comes with. So if they have too much that they already have on their minds, it's very hard then for them to get clarity of thought of these are particular thoughts that you need to change, So then you have to peel it like an onion one after the other and then separate it and then kind of help them. And that'll take a long time. And we don't normally have that much time to work with, and we're not actually advised to work too long with a student. So if we feel like it's too much, we don't see change happening, then we do refer them outside of BSBI. But as much as we can, we try and keep it in-house and try and, yeah.
Thank you so much.
Then I think what he was saying that, you know, one problem of CBT is the fact that we are scared, you know, he was saying that, you know, we are scared of going to counselor, to a psychologist, you know, we don't know enough about, you know, it sounds strange with this CBT, no?
I have one more question. I'm just curious to know, which is the most common techniques in CBT that you guys use? Common techniques, usually.
Mine is, that's why I shared it with you and put it out there. My secret medicine is A plus B equals C, of changing the thought, because that's the basis of CBT. Do you know what I mean? And I like to journal. I used to do it quite often, and so I encourage my students to do the same, to write out negative thoughts and then how we can change them into positive and then put that into practice.
Fantastic.
So that's a technique that we use. Yeah.
Yes, I used to work in a praxis. No, do you call it? What do you call it? In a GP praxis, you know, and I was at Queen's University Belfast, where I used to work there, and you know, as she says, the 5-part model is typical. So it's like a schema that you have. You said, as she says, where you had your thoughts, you know, what was doing at that moment, the situation, you know, you describe in particular what was going on, and really try to, as she says, like a peel and onion, just to find really the thoughts. And then you try to balance it out, you know, to balance it out. And then the common technique that is usually used is, you know, the behavioral change, because either you change your thoughts or you change your behavior, no?
Yeah.
And you do all this crazy behavioral experiment that I used to do with my school, Anna Murphy, you know, because CBT is used also for phobias, no? Maybe somebody is scared of spiders, so you start showing photos of spiders. Look at this, like, no, I don't want to see it. Just see it. No, I don't want to see it. So you see a photo of a spider, then you see the photo of more spiders, then you see a documentary, then you go to a zoo, and then you take your spiders in your hand, you know? It's like, you know.
I will try that in my next life with my phobias, not in this one.
Thank you so much.
Well, I would say that there is the long-term techniques for CBT and short-term techniques. Like short-term techniques, maybe if that's what you're asking for, like diaphragmatic breathing, maybe for immediate response from your body, could be, yes. And other techniques, like you explained, it could be taking longer. And that is taking me to the previous question about the challenges or barriers for students to be participating in CBT. That short academic term, by its nature in universities, also the existence of assignments and the workload, student workload and homework as well. Those are challenges that the student is not having enough time to think or to meet and participate in those meetings as well.
Yeah.
Yeah.
True.
Yes. Yes, I have a student in mind. Very good.
Hello.
Hello.
I was just curious.
Introduce yourself, please.
Hi, I'm Amy. Oh, I stand up. Okay.
Very good, Amy. I'm very proud of you. Thank you so much.
Okay. My name is Amy. I'm a student in Dr. Barbara's class. And I just had a quick question. If CBT can be used in like a peer-to-peer basis, like if a friend wanted to challenge the thoughts of another friend, maybe that friend is going through a crisis, or would that be considered unethical given that there would be biases involved? Yeah.
Well,
I say yes.
I think you should
Clinically, yes.
Yeah, you should be trained. You know, it's a long process. Yeah, maybe I think a bit of psychoeducation is very important, you know. But I think you need always the training because you know there is some psychologists, some philosophers think that we are all psychologists, but or all counselor, or we are all a bit of everything, you know. But you know, there is a training, minimum is 2 years, it can be longer, there are masters, and I think the first point of contact should be always somebody who's been trained. But on the other hand, I think it's very important, as you said, to pass on, you know, the words and explain, you know, what's that, just read this book and, you know, Pedesky book, sorry.
Yeah, for me, I think if it's a close friend and they're confiding in you, that it's okay, that you don't suddenly become a counselor and you're still a friend and friend. Because they always say you should never counsel friends. Dual relationships are not good when you're doing. So if, even for me, if friends say, can you please counsel me? I'm like, no, you're my friend. I don't want to lose you, you know, so ever. So it's important for you to, but it's okay for you to encourage your friend and say, hey, especially if it's something that you think that it's just a matter of how he or she's thinking, you can help them, like guide them through it, but not have like a big 1 hour counseling session. But I think it's okay for you to offer some advice. Yeah.
Or being the connecting point, that you now do understand that your friend is in a need for help, but still feeling shy enough maybe, or I don't have enough time maybe, or I don't know that I am supposed to be talking to a specialist. So you could be the connecting point.
Yes.
That helps a lot.
And then send them to me.
Yeah, that was the saying, and yeah, I think ethically, you know, as a therapist, as a counselor, you cannot counsel friends, you cannot counsel family or friends of a friends. It's always, you know, and then also because you're going to know things that, you know, and also when you had, you know, you've been a therapist, a counselor person, you cannot date this person, you know, there is a whole ethical booklet there, but actually it's a very interesting question. But there are self-help books, maybe you can say, okay, let's read together, you know, Christine Pedesky, Mind Over Mood, which is a great book with exercise, because, you know, she gives the exercise and she gives you homework, and, you know, you can do, you know, you can read together, let's read together, let's understand this together, let's try to understand this together, let's learn together. And I think it's a fabulous thing, better than a chat box for sure. Yeah.
Okay, thank you.
You're welcome.
I see another question there, no? No, I'm sorry. No other questions, no? No, but you know, all these things of the automatic thoughts, I think that she's explaining how you change them. That is very interesting. They come from your core belief, and she was telling you CBT doesn't go back, you know, like psychodynamic, you know, about your life, your childhood. But this core belief come from your childhood, and is how you see yourself, how you see the world, and how you see the future. And sometimes, you know, you have these black glasses that you put on, you know, and so that's very important. And I'm just wondering, have you ever done? Sometimes one of the technique is to do sort of rehearsal, like a dialogue of people that are really scared to speak. Have you done this technique?
Like a role play.
Role play, yeah.
Yeah. Some, not here, I haven't done it here, but I've done it before, and it's quite powerful.
How does it work? How it is? Can you explain?
So once you help them with the reframing of their thoughts right in the beginning, then you kind of, so it depends who they're having an issue with, and sometimes it can be, it's really painful because you hear, I mean, there's a lot of tears and a lot of heartbreak that goes. So who I've done it is a parent-child kind of a relationship, and working with the child because it was a very strict parent. And so kind of doing the role play, I worked with the child first and then called the parent in and worked with the parent. And it was super tough on both ends, and I never want to do things like that again, I hope. But it's because the parent has to reframe their sentences too. They have to reframe their thoughts too, because I can work with the child as much as possible and do role play being the parent, but I also had to do that with the parent being the child and saying things, and yeah, it was quite powerful.
Yes.
So, yeah.
Yes, and what about the other question that do you reveal, you know, as a doctor, as a therapist, do you reveal something about yourself when you are with in front of a person in need or not? Because this is a kind of difficult issue. For example, you know, you're a surgeon, maybe you say, I was scared of doctors when I was a kid. I don't know, just imagining something, or you know, you're a therapist, so somebody comes to you and he says, yes, you know, I think sometimes I'm a failure too. Do you reveal something about yourself, or you just, you know, don't want to do that? Maybe you just, how does it work, these boundaries? Yeah.
So I don't go into details, but I do, if I've been through a similar situation, I do empathize with them. And once they share their story, once they tell me what they've been through, and I say, I completely get it. I know what that felt like. I know this is what I felt like when I went through this. And for them, it just changes their world, because it's like, you went through the same thing I did. But then there's two sides to it, because some people say you shouldn't, but I feel like if the situation is right, I'm okay to share, because it is confidential at the end of the day. That whole session is confidential. Here, not so much. I haven't done it with my students, but I've done it before.
Yeah, because
here it's a different type of relationship. So
yeah, you're right.
I'm quite mindful here. But otherwise I have, yes.
Yeah, because I think the person in front of you is going to feel that you felt, you know? I mean, because we don't just communicate through words, there is all the mimics, you know, you were saying the importance of communication before, no? So it's going to know, so why not?
And I'm not afraid to show emotion either. Like if it's really a heart-wrenching story, I will cry.
Yeah.
You know, I mean, I can't not have, I think it's my mother instinct that comes out, but then if I am hurting when they're saying a story, then there are some tears that are shed. Do you cry, Ahmed?
Actually, in clinical setup, I just use the knowledge and educational lens. I can see everything through, so my mission there is to apply that knowledge, helping people and so on. So of course it could be happening that at some point maybe something could be moving my emotions or so, and this is not incorrect. We cannot say unprofessional for that, but we have to control it as well, not to be negatively affecting the patient.
Yeah.
Yeah.
It's a bit difficult. It's a bit difficult.
So
balancing is very important in this case. Yeah.
And just a piece of advice, even for students who are wanting to be counselors or psychologists or whatever, I think our job is to empower the student to help increase or better their quality of life. We do what we think is best. We offer advice if that's what they ask, use the techniques, but then once that session is over, we leave the issue there. We don't take it home with us and kind of transfer it into our lives, because that often happens and that's very dangerous. In my initial days, it did that and it impacted my life a lot. And so I really had to learn how to step back and kind of leave an issue where it is and move on, so that we can be available to help other people too. So
that's true. That's very true. And actually, this is very important for all the students of psychologists, because you can go, when you study psychology, you can go towards different direction. You can become a therapist, a counselor, as she became, but you have to know yourself, or you can become a scientist. You know, just to do experiment and be really, you know, psychologist or scientist, or you can go towards business, marketing, everything else. So it's a very much so who I want to be, and it's very important to know, CBT and emotion and everything else, Maybe I have another question. I remember one of my, because clients or patients, it depends on what country you're in. Sometimes I call clients or patients, okay. Then he was suffering from OCD, and he was always checking the car that if everything was fine. And coming from a place like Belfast, we understand that because under the car there were lots of bombs and everything else, so maybe it was the reason. So one, it was travel support, post troubles, society emerging from, and so one of the things that I told him, okay, you leave the car there, and for 1 week you don't have to check it. Ever happened to you to give such a cold? Did it work?
I haven't. No, I'm not. Sometimes there are, and again, this was a conversation we had in our office. Some students just want you to just tell them what needs to be done. You know, there are some patients or clients or students just, this is what you need to do, and they will follow it point blank. But they say it's not good to do directional counseling like that. That's not the whole purpose of counseling.
Yeah.
It's to provide direction, not to give direction. There's a difference.
Yeah.
And so I try not to do that. With my child, yes, I do, but not with my patients.
Yes, but I mean, for OCD, it's a way. It's a way that you have to stop the thing, and it's actually a technique. It's a technique, a typical technique. Instead of doing step by step, you just do cold feet. You just you just put somebody who's scared of being on the plane. You just put the plane. Then when they go back, are you dead? No, you're not dead. So you survived. And that's what sometimes full exposure. So it's instead of step by step, you have the full exposure, and I think it's very much I think important to have that as well. I had a question for you, but I was speaking and the thoughts fly somewhere else, and I kind of lost it. No, it was a nice question about the medical profession, yes, and you had somebody that was really, really much pain. I know CBT helps you. Also, after surgery, you've seen people that were in very much pain, yes? And that the recovery was very difficult, right?
Yes, could be. Like, pain is a response from our brain to keep us safe from danger.
It's important. Pain is important, yes.
Maybe I twisted my ankle, and now it's time not to use my twisted feet, maybe, or so. So it's protective. I could say it could be part of the immunity we have, that we are protecting our bodies. But that is within the limits of having tissue damage in our body physically. Now we need to differentiate between what kind of pain is limited to tissue damage and what is really exceeding that limit and taking us to the psychological part or the emotional part. Do I have thoughts about it, or it's really pain there? Mm-hmm.
Yes, I was more. Yes, this is very true. You're right, but I was going more just to finish off saying that the CBT is also very important for chronic pain.
Absolutely,
it's being used in that.
No doubt, and it is being used as a protocol in any emergency room, in hospitals, pre and post surgical. Periods of the patient's hospitalization.
Yes, that's true. I agree.
Yeah.
Okay. If there are no other questions, there's one question for line. Okay, very good.
I will read it. You can.
Thank you so much.
I asked them to restructure it because it doesn't make sense a little bit, but maybe you understand. So, what are similarities, challenge, and change learned to modify these thoughts to improve mental health? I asked for restructure, and he said that the challenge and change, that's my main objectives.
Yeah, because you know, challenge and change just to restructure the thought. The challenge is she thought she just said them. You know, you have to peel an onion sometimes. You have it's difficult to catch the thoughts. So you have to teach them, right?
Yeah, and I think you can't change all your thoughts because thoughts are constant. I mean, I don't know, I forgot how many thoughts we have. I mean, there's not a time in, especially when we're awake, that we don't have a thought. But it's important to pick the thoughts that are repetitive, that make an impact in your life negatively. And those are the ones. So it could be just one thought that you work on per week and change or reframe the way. It could be something that your mom or dad said to you repeatedly when you were a child, when you were 2 or 3, and it's stuck in your head and it keeps coming back, you know. It could be something like that, that you kind of have to reframe and say, no, it's actually not true what they said about me, but this is who I am. So it doesn't, you can't, it's not possible to change all your thoughts, but maybe picking the ones that are most common and the most that bother you and is a trigger for you, because you could hear someone else say the same words to you and that's enough to make you sob or cry or hit them, you know, whatever it may be.
We don't want that.
We're trying to avoid that. We're trying to not make you get aggressive. So, yeah. I don't know if I answered that question.
I think so. I think your answer is perfect because, you know, we don't understand that sometimes, you know, we have lots of automatic thoughts and we have to choose the one who creates problems in our life. You know, for example, nobody loves me, you know, that's more a core beliefs, no? But I'm unlovable, and the thought is like, you know, I cannot make friends. I'm not able to make friends, you know, something like that. And then because it comes from the core belief, I am unlovable because maybe, you know, your family, you know, you were not so much loved, you know, who never saw, or, you know, I cannot do anything right, you know. I'm a failure. It comes from I'm a failure, the core belief. So, and you change the thoughts, you know, you change the thoughts, and then the core beliefs that is inside, that you know, the core belief is here, no? It's like the roots, and then you have the trees, and then you have the thoughts that are here, no? This is the lot of leaves. So you pick the leaves, and then the roots is going to change a bit. I don't know. That's it.
Good way to look at it.
Yeah. So anything else from my students? Nothing? Have another question? Yeah, introduce yourself, that would be great.
Hello, I'm Sukhman, and my question is that, like, we are also studying psychology and maybe one day we'll be a counselor or therapist. So does the things get way too much for you guys? Like, you are listening to all the people and their problems, and there might be something going on in your life as well. So how do you cope with these things?
That's a great question.
There's always something going on in our lives. This is true, but great question, a practical question. So when I went through my master's in counseling, we had to go through counseling sessions ourselves as a client or a patient. We had to find a counselor and be the person who's getting counsel. We had to have a certain number of hours of counseling we went for. But I was 21 at that point when I did that, and then I went straight into being a counselor and started individual sessions for clients. And that's when I said I was taking all of these issues back home. It would bog my mind. And don't get me wrong, it still does. If we have a tough student that we're working with, someone who's just mentally distraught or suicidal, even here at BSBI, it really bothers us, it really bogs us down. But I think at the end of the day, as a counselor or as a therapist, you need to know that you did whatever you could and offered the help that you could during that day, right? You can go the next day and check in on the student or check in on your patient if you want to, but you need to convince yourself that you did everything that you could during that session and provided the support that they needed during that time. Yeah.
Yes.
So, and you just got to leave it at that, knowing fully well that you didn't delay giving the support. And if you ever, as psychologists or therapists, as you finish studying and you go to a social setting or you go to a party and they're like, you're a psychologist, you can read my mind, say yes.
And that's
will
a
hear it all the
perfect
time.
final note.
They will be like, can you read? Oh my gosh, be careful what you tell her because they can read your mind. You're like, you absolutely can. You can't, but you know, let them think otherwise.
That's fantastic. And I think if there are no other questions, we finish with this. Okay? This is our end note, you know, final note. And I'm here to thank you very much for being here. I'm very thankful to all my students that stayed here with me and to everybody who came. And thank you so much for coming, and thank you for my guests. You are wonderful.
Thank you.
Thank you, Barbara.
Thank you so much.
Yeah. Thank you, Ahmed.
Thank you, everyone.
Thanks, everyone.